Move into our 8:35 item, COVID-19 update. Public Health Director Kathy McKay and Jamie Hennon, and Becky is back again as well. Good morning.
Good morning, Mr. Chair and Commissioners.
Good morning. Kathy, I know while you're getting that ready too, maybe when you're done with your report, while you're here, we can just talk a little bit about our discussions that we had at PIC regarding the, okay, I'm catching you.
Just a moment of, let me remember what we discussed.
Well, it was based on the conversation that we had with the masking deal.
Oh, okay.
So.
Will do. Okay, so here's our updates on cases. So on September 27th, we had 290 active cases in Clay County. And now you can see October 4th, we went up a bit to 310. Cass County also went up from 619 the previous week to 755 cases. And then in Minnesota, we're seeing some increases in cases across the state from the 27th through the 4th, and also increases in the cases in North Dakota as well. The next slide is active cases by age. So you can see that we're still seeing the active cases, mostly in the school age, and then we're seeing some in the 20s and 30s as well. But again, it's active cases have been majority of the younger age groups. Our cumulative cases by age on the next page, so our total is 9,659, and this has been as reported throughout the pandemic. So there's the cumulative cases, and the 20 to 24 remains the highest at 1,237 cumulatively. The next slide is the cases per week. So we're seeing the number of cases from July and now through September. So it just gives us the trends of the cases per week since July.
Is that following? I was listening to the national news, and they said the trend throughout the United States is that it's coming down a little bit. Are we seeing that here yet, or?
Yeah, it varies state to state. I don't know if nationally it's actually, it may be, I didn't hear that on the news, and I don't know if Becky, you've been aware of the national trend at all?
I have heard the same thing, that on national wise it is trending down. However, that's not the case yet for Minnesota.
The next one shows our cases per week, and back from March of 2020 through our current. So we're looking like we are obviously in the fourth wave, and from our numbers at the same time for the previous year, we are higher than what we were back in that same time frame in August. So, and again, we repeatedly say that there's always that delay in reporting cases. It just takes a while for all the cases to be counted. So, and we'll go to the next page. Becky will talk about that.
So this graph shows Clay County deaths reported by week. We didn't have any newly reported deaths from last week, so we're still at the 97 total deaths for Clay County. And this graph depicts the number of COVID hospital admissions per week for Clay County residents. So we're still seeing an elevated number of hospitalizations. There were 11 COVID admissions during the week of September 19th. And then for last week, we've had 5 reported so far that have been hospitalized. Again, that number may go up as the data has a chance to catch up.
Are those new admissions, or are they currently in the hospital?
So those are new admissions per week. Some of them have been discharged, some of them have not. And this slide breaks down recent hospitalizations of Clay County residents by age. As you can see by the pie chart on the left, the majority, or 65%, of those admitted to the hospital are under the age of 65. The bar graph on the right breaks down the admissions by age group. And so we've had 2 more pediatric admissions since last week, one in the 10 to 14 age group and the other in the 15 to 19 age group. And we've had a total of 57 admissions in Clay County since August 1st, average age being 53. And then this slide again shows statewide hospitalization data for North Dakota as of yesterday. There are currently 157 hospitalized due to COVID, with 24 in the ICU. The number of hospitalized has increased from 133 last week at this time, as well as the number in the ICU. That number was 21 last week, and it's at 24 currently. The chart in the middle shows current hospitalizations broken down by age groups. You can see there are, unfortunately, 5 pediatric admissions. The chart on the right shows age groups of the total admissions throughout the pandemic. So the number of COVID admissions in North Dakota is actually at the highest right now since December of last year. And then this is the updated graphic from the Sanford Medical System that they update every week. This is updated as of September 28th. Again, the red people represent those that are not vaccinated, and the white represent those that are vaccinated. The overwhelming majority of hospitalized cases continue to be among the unvaccinated, and all of the 28 patients currently on ventilators are unvaccinated. And then this is the data on breakthrough cases. So we have seen a little bit of an increase in the number of reported breakthrough infections. So we're a little over 1% now for Minnesota. Breakthrough hospitalizations are still quite low at 0.053%, and breakthrough deaths are at 0.006%.
Okay. Jamie.
Morning. So looking at the vaccine that's been provided by Clay County Public Health, our total is 15,587 doses, and things to continue to trickle, but local public health is focusing on first and second doses, and vaccine is plentiful in Minnesota and in our community, but we provided just 24 doses last week. So we are working with Minnesota Department of Health to gear up for boosters and also for flu vaccine together. So we'll be doing that, doing some planning. Just want to stress that those boosters are for Pfizer only. So if you've had a Pfizer first and second dose, you can have a Pfizer booster. And then going to the next slide, looking at the statewide data, all across Minnesota, individuals with at least 1 dose of vaccine were at 72.4%. Last week it was 71.7%, so slow progress. And then people with a completed vaccine series, 68.8% in Minnesota, and last week we were at 67.9%. And then you'll see the breakdown by age group there for at least 1 dose, and those completing the series as well. And this is for 12 and over, so that's what we've been tracking. And then I'll just talk a little bit about what we are doing this week for our clinics. We have a clinic at the Family Service Center, and again, we've been rotating over the lunch hour and then doing an evening clinic. And so our clinic this week is on Thursday at the Family Service Center from 2 o'clock to 6 o'clock. We're offering first and second doses of Pfizer, and we also have Johnson & Johnson. Offered Johnson & Johnson last week as well. With those, we also fill in, we go to the long-term care facilities that have a single dose, we go to people's homes that are needing that dose, and over to the jail and juvenile detention centers. So at the end of each clinic, that's what we do with doses. We also are planning to do a special population group that we're going to be working with Moorhead Housing on this week, and that'll be on a Thursday clinic. And then we're doing some second doses at the Uland School to finish up Pfizer second doses, and that'll be on Wednesday. And then, did you want me to talk about this report? Okay.
I have a question quick on your vaccine clinic. The amount of folks that you served in that last Thursday, were the majority of them second doses, or did you?
The majority of that was Johnson & Johnson.
Okay.
Any other questions for Kathy or Jamie or Becky?
She has
got
one more.
We got one more, okay.
Kathy asked me to share the results of the survey that was completed, or still is underway for staff.
Yes.
And so, looking at the total number of employees, 619, as of Monday, 60% of those employees had completed the survey. 87% of those that responded, again, we're not finished with the survey, but of those that responded, 87% were vaccinated, 12% were unvaccinated, and 1% was partially vaccinated.
Just maybe a follow-up comment to that. I had some staff reach out to me questioning why we were doing that. And I think it's important to note that that's something that this board had asked for, and feel that it's really important for us to get a good handle and understanding about the vaccination status of our staff, so we can make policies to move forward. And so it wasn't staff-driven. It was something that this board really feels that it's important. So if it's completely confidential, it's information that we will be using. So I encourage you, if you've not had an opportunity to reply to that, to please do so. It will really shape how we look at masking mandates or other restrictions moving forward.
I want to echo that, and this kind of dovetails into where I wanted you to stay regarding the PIC meeting, where we spent some time talking about the board's decision last week. And I know in the motion that was made, it was suggested that we review it in 2 weeks, and I'm assuming that's a good thing, and I'm assuming we'll keep doing that, But part of what, through the PIC meeting, and this is what Commissioner Mojo talked about, this wasn't staff that requested this survey. This survey was requested out of our PIC meeting. And it's done for a couple of reasons. It's done to get ready in the event that the federal process that's out there does hold up and it's implemented, which would require us to do it. So we wanted to be ready for that, so we just thought on a volunteer basis. And again, we don't know who those people are, and that wasn't the intent. The intent was so that we can have better data to make better decisions on what goes on within our county campus, to keep our employees safe and to keep those who come here safe. It's as simple as that. And so I think these numbers are encouraging when I see 87% of those that have responded have been vaccinated. I think that's good. But Commissioner Moschel, you wanted to?
I didn't have a comment. I just wanted to clarify maybe the math on that. So is that, of all the responses, 322 of those of staff are vaccinated?
And it's as of Monday, there were 373 responses.
Okay.
Of those, the breakdown of the numbers, fully vaccinated, 326, not vaccinated, 43, and partially vaccinated, 4. And so what I shared with you were the percentages of those that have responded.
So it looks like we are at least 50% staff vaccination fully.
And I'm assuming, and I'm kind of looking maybe back at Darren for a head nod, but when we talk about 619, does that include our variable? And right. So for the people watching here, when we talk about variable hour, those are people who might be called in at certain circumstances to fill shifts and that type of thing. And they're included in our total number of 619 or 620, whatever that is, but they're probably the least likely to maybe even receive the information, the request for information, and to respond. So, but the fact that we had 326 fully vaccinated out of 370 I think it's a pretty good number. Hopefully that can still go up.
Yep.
Or Becky would like to see that go up. But, so we, so going back to the PIC meeting, and I'm kind of getting into my portion of the committee report regarding that right now while you're here. So we asked for that information. We want to kind of start to understand, maybe separating out what goes on within our campuses versus the rest of the community too. So that's kind of a deal that's important to us. If we have a significantly high number of vaccinated people here, for the workers, it might mean that we do some sort of a different type of a masking deal. I think right now when we have people come in, we ask them to wear masks anyway.
Right.
As a matter of fact, I think in some instances, it's required of them to come in, right, Kathy?
Correct.
So, in our PIC meeting, we didn't come up with a reason yet to withdraw our current plan for masking, but I think Kathy assured us that she will be monitoring us, and at the earliest possible time, we'll see if we can remove that. Nobody likes it.
Right.
I don't like it. That day when I sat with my mask on in that room, I didn't like it at all. It's uncomfortable.
Right.
And I was at another meeting yesterday with Mr. Melton, and I was over an hour and a half in a meeting with a mask on. I didn't like it. But, so, and I don't know, Commissioner Mojo or Steve or Brian, anybody else from PIC that was there, but I think right now, unless you come with us next week with something else, we'll just have to continue this for a little while until we get through this, hopefully this peak, and if it's true that, and the trend is coming down, we can maybe
Yep, that'd be positive.
sooner rather than later, but.
Right.
Anybody else? Commissioner Moser, do you have anything else?
I think it's really important to stress the piece of the survey. That's something that's really important for us as we develop what a policy looks like. But I'm struggling a little bit with consistency, and I had some business to do in the Family Service Center last week, and also had walked around the campus a little bit, and there's not everyone is following it, and I that's personal preference, but I think it develops, there's problems in terms of who's enforcing it, and is it the greeter at the Family Services Center's job to do that, and once they get by, so it's, the board decided to put that on there, but I just struggle a little bit with the inconsistency piece. I think what my argument was a week ago is that as intelligent adults, we can make our own choice to space ourselves out and use hand sanitizer. And as a board, we've made choices to put barriers up and keep staff as safe as we can. But it's just, I don't know, Steve, if you have any comments on that, but is it a department head's job to follow up on that? I mean, they have a lot of important business as well.
Yeah, we certainly have asked reached out to all of our department heads and made them aware. We handed out a masking policy that Kathy updated along with Darren last week to all of our employees. So the expectation is that they continue to wear masks. I think one of the things that I've heard from the Family Service Center is it's not necessarily just our employees. It's a lot of the people that are choosing to come in for services that maybe one aren't coming with masks or two are coming with masks, and once they get past our greeter, are taking them off.
Last Thursday and Friday, I was over at the Family Services Center as well for 2 retirements that went on over there. They had little internal deals for them, and I happen to know both of those people who were retiring, and I've known them for a while, and I served with them on insurance committees and things like that, and they just kind of had it in the hallway up on their floor, and every single person was wearing a mask, and I'm presuming I'm safe in saying that every one of them wishes they didn't have to, but they did it. So hopefully this will be short-lived and it doesn't become the new normal for us. So, all right, I think thank you for staying around for that, Kathy, and And anytime, as far as you're concerned, anytime where you think there's something that could change, you can let us know, and if you want to talk about it further, or you think there's some more things that you'd like to see happen through PIC, we can
Okay,
have a PIC meeting on the spur of the moment if we have to, so just so you know that, so, all
thank you.
right?
Okay, great.
Okay, thank you.
you.